Now, there's just one way to correct that. And when you get in this situation like that, you got to put the patient back, sitting position like that, and get your contact here. And you got to pull this around here like this. You got to pull it toward you and around instead of across. You got to get up here and pull it toward you and around instead of across this way. See? Then you're correcting the laterality and the rotation in one adjustment. Get it? That's the way to do that. See? Get a hold of it like this here. See? And then you gotta pull it this way. See? It's got to come that way. See? And not this way. Now there's other ways here. See, you're shoving it that way, but see here, it's got to come this way. See? It's PRI lamina. It's a PRI lamina. See? The body has gone to the right. The transverse has rotated to the left. So you got to correct the right, get from right back into center. You understand now? Get right back into center, and also the rotation from back to front, from posterior to anterior. That's very careful. You can do a lot of harm in that case. Yes, doctor.
My motion palpation is cervical spine, and you're saying that you should grab the spine and determine the side of it.
Right on the side of the spinous, yeah. Mm-hmm.
Not over towards the lamina.
Oh, yeah. Yeah, a little bit halfway between the lamina and the spinous. On the side of the spinous, halfway over. But on the side of the spine, not right in the back, but on the side, see? I like to, with just about here. Right there. See, with my thumb, then my other finger over here. See, then my other finger right there, see? Then I've got it, see? Then you bend it this way, it goes into your thumb, and if you bend it that way, it'll go into the other finger, see? That's the way I like it. But in adjusting these, and that's true down in the cervicals too now, if you've got a PRI cervical, a 6 cervical. You've got to be very careful when you get on the transverse. It's already right, and if you get up here on the lap of the 6 cervical, you can increase the laterality. And I've seen it takes about 3 adjustments. I've seen a lot of these fellows that you diversified technique, you re-x-ray some of those patients, and you can create a terrible laterality of the axis. They're set way up high there, see?
Then they are diversified.
It is diversified, yes,
The patient.
The first patient is diversified. Now you check up on yourself in doing this. Be very careful that you correct the laterality as well as rotation, see? It's very necessary. And it's the same thing in some of the schools in adjusting an atlas now, for instance. Now, some of the schools, and we've done it in the early days, they adjust an atlas ASRP, for instance. See? Now, an ASRP atlas, they get up here like this here, that's being taught, see? ASRP. See? That isn't so bad, see? That's okay. But when you have an ASL, see, now, the shear corrects both. You get up here just the atlas and the ASRP. That ain't too bad. But if you have an ASRA, for instance, see? Then when you have an ASRA, then you correct the A, but you increase the laterality. See? Now, what's that? What's that? Oh, yeah. Yeah, now when you get, now here now, will you get the contact on the 6 cervical here now, see? Here's your spinous, you get right up here now, see? There it is right there. Now this is the lamina contact. Again now, when you adjust that, it's got to pull this way. Don't adjust it that way. See? Now you'd get it like this here. Put it over here. Now it's ready for setting. But when you adjust that lamina contact, it's got to come like that. That's a PLI. Yeah, you don't tip it in more than that. See? But instead of shoving it this way now, it's got to come that way. See? So because it's already left. See? But it's rotated back on the right side, so you want to adjust the body from left into center, and the transfers from posterior to anterior.
You don't contact the spinous at all?
No.
To help pull it, just on the lamina?
Just on the lamina. Mm-hmm. When it's rotated there for a lamina contact. But if you want to just, if you want to use a pull on the spinous, you can too, but then when you use a pull on there, then it's not a rotation, just straight, see?